Along with the concerns over global warming are also worries that the warming temperatures are helping to boost the tick population here in the North Country and Adirondacks. There's been a significant uptick in ticks in northern New York, and now health officials are sounding the alarm as new numbers reveal just how bad it is.
We're anticipating that our total numbers by the end of the year will be higher than last year's based on where we are right now.
There have been 100 cases of tick-related illnesses so far in Clinton County, with several months left in the tick season. Molly Flynn with the county health department says last year there were 140 cases in all of 2022. That data tracks what Paul Smith's college biology professor Leanne Sporn sees, that ticks have become increasingly more common in the North Country.
The driving force appears to be climate change. Warmer and wetter summers and less severe winters. It's just allowing tick populations to establish here.
A perfect storm that means more ticks carrying a variety of diseases.
Certainly Lyme is our highest number, but anaplasmosis would be our next highest, and it's over the past few years been increasing very steadily.
And Leanne Sporn says that uptick in the number of ticks has led to new messaging by health officials.
We are now in a realm of tick bite prevention, not tick checks. Tick checks are important, but it's more important to make sure you prevent that tick bite in the first place.
Prevention tips include avoiding tall grass, brush, or wet areas, staying on the trail if you're hiking, using EPA-approved bug spray, and wearing pants, long sleeves, socks, and light-colored clothing so it's easier to spot ticks on you. And Dr. Keith Collins is an infectious disease specialist at the UVM Health Network CVPH Medical Center here in Plattsburgh. Welcome back. It's good to see you again.
Thanks, you too.
The health department's prediction that we're going to see a record number of tick bites and tick-related illnesses this year doesn't come as a surprise to you, I imagine. You've been warning us for years that this is likely going to happen.
Yeah, every year it seems like we seem to creep up a little more and a little more each season. And this year is no exception, unfortunately.
The temperatures have increased over the past several years. Not a big jump, but enough that the ticks now are surviving the winters and we're seeing the populations grow.
Exactly, we really are. And every year now I see more and more patients that are winding up admitted to our hospital with some type of tick-borne illness. Even this week I've seen 2 different patients admitted with 2 different tick illnesses, that one in our ICU that was really sick.
For a number of years, it seems we were most worried about Lyme disease, but now we're seeing a number of other diseases that the ticks are carrying.
Exactly. I'm really glad you brought that up because everybody knows about Lyme, and they should. But for the most part, you're going to get over Lyme disease unless something is really, really wrong with you, and we can treat it with standard antibiotics. A couple of the other illnesses are quite treatable, but they can be potentially life-threatening, particularly anaplasmosis. It's basically a bacterial infection also carried by ticks, carried by the same tick that carries Lyme. In fact, I have seen people myself with both infections at the same time, and it's much more serious of an infection than Lyme is. We've seen in our own hospital 2 deaths in the last 3 years from anaplasma. Yes, you can get really, really sick from Lyme disease, but it's rarely fatal. Whereas anaplasma has somewhere around a 1% mortality.
Is Lyme still the most common disease that the ticks carry?
Yes. I think it's still fair to say it's probably the most common, but anaplasma is catching it very quickly around here.
And are you seeing the number of cases coming into the hospital increasing?
I think that this year I've seen more anaplasma than I saw last year. Lyme, I think it's about the same. But to give you an example, right now we have 1 patient in our hospital with Lyme that sick enough to be in the hospital, and we have another one that was in our ICU with anaplasma.
And is the black-legged tick, the deer tick, the most common that we have here?
Yes, that is the culprit, the black-legged tick, and there's actually 3 infections around here right now that the black-legged tick carries that are, I think, worth talking about. 1 is Lyme, 2 is anaplasma, and the 3rd one is something called babesia. And I don't know, that's one that we are just now seeing coming to our area, but it's clearly here. I've seen cases, I know there have been cases at Elizabethtown Community Hospital. So it's here too. And it's also a bacterial infection carried by the black-legged tick. So that one tick can carry 3 really serious diseases. And we have seen all of those happen here this year. I've been here now for 32 years. When I first came to this area, when I was in training, I was told that tick-borne illnesses don't happen here, that they're so rare, don't even think about them. And now everybody has to think about them that's in healthcare, taking care of patients, because they've really, over the last 30 years, it's just, especially over the last, I'd say 5, it's really taken off and exploded here.
Are doctors and clinics getting better at looking for it and identifying tick-borne illnesses?
Much better, much better. I can see a difference over the last couple of years where I used to see patients and have to make the diagnosis for them because they're not trained in infectious disease. Doctors now suspect these infections and usually have done the testing even before I go see the patient, and they've started them on the right treatment a lot of times. So it's definitely changed. They're much more in tune to the fact that we have these infections around here.
Dr. Leanne Sporer is a tick specialist at Paul Smith College. We heard from her just a few moments ago. You and her, for a number of years now, have been going out in the community and warning people about the danger of ticks and tick bites. You folks are, again, stressing that people really need to be aware. Look for tick bites, which is good advice when they're coming back from a hike.
Right.
Check all over your body and look for the tick bites, and I guess the telltale signs are still the rash and then the red bullseye.
That's for Lyme, yes.
For Lyme?
But with Lyme, the most common rash is actually not the bullseye. It's just an area of a patch of a red rash, rather than just a single patch. That's more common than the bullseye. The bullseye is pretty characteristic, but it's not the most common.
Okay, so look for a red
and the
rash.
And the other two really don't cause, you can get a rash from anaplasma, but it's not very common at all. And you don't typically get a rash from babesia. So those just give you fever, headache, muscle aches, chills, those kind of things.
In some cases, you find the tick, and the advice is use tweezers to remove the tick.
Yeah, and that's another important point. Only about half the time will someone know that they've been bitten by a tick. The other half of the time, they will not recall it.
And treatments, are treatments getting better for Lyme disease and some of these other tick-borne illnesses, as far as if you're diagnosed with it, that we're getting better at being able to treat people so that they can recover?
Well, I think the treatment really hasn't changed much, but what has changed is the ability to diagnose the infections. We have these really good tests for anaplasma and babesia that are blood tests. Those are really good tests. With Lyme, we still are struggling with a really good test for Lyme in the early stages.
Any talk of vaccines? Are they down the road?
I think they're coming. In 1998, we actually had a vaccine for about 2 years, and it got pulled from the market. It wasn't very effective, and it had a lot of side effects, but I think maybe within the next couple of years, we'll actually have a vaccine release that'll be a lot better. The trouble with a vaccine for Lyme has always been there are so many strains of Lyme. Sort of like, think about, again, COVID. You talk about all the variants of COVID. Well, there's lots of variants to Lyme disease, and so it's hard to make a vaccine against all the different strains. But they're getting much closer, I think.
So precaution and prevention are the
Exactly.
key really now.
That's one thing I would say. Is I know it's easy to say, but they are, in theory, preventable infections. You really have to be vigilant to prevent them. But in theory, you can prevent yourself from getting these things if you're very, very, very careful about things. And I would recommend that you do that.
We're hearing about new COVID variants. You were just talking a moment ago about COVID. A few new variants out there, a few high-profile cases just this week, including the First Lady who had all her shots and her boosters. Are the numbers starting to go back up? Are we seeing more COVID cases?
We are. Nationally, I was looking at this yesterday. Nationally, I think we're up 17% of total cases in 1 week, and we're up 16% in the nationally in hospitalizations in 1 week. So things are definitely climbing. In New York State, it doesn't look like we're getting there just yet.
We're hearing about a new wave, new generation of booster shots coming. Both Pfizer and Moderna within the next few weeks will have updated booster shots.
Yes. And the question becomes, has been really important lately is with the new variants, will these vaccines work? The vaccines were made against a different variant called B.1.5.5, and that was the variant circulating, the last Omicron variant. This vaccine was made against that variant. The newer variants, at least in the test tube, it looks like they still work, but the current variant, that's called for BA.286,
yeah.
yes, BA.286, that one has over 30 different mutations compared to the other one. Moderna just released where they looked in the test tube to see if the vaccines work against that particular variant, and it looks like they still do. They're not quite as good against some of the older ones, but they're still probably way good enough to prevent a lot of infections and probably way good enough to prevent hospitalizations. At least it looks that way, at least preliminarily, and I hope so.
And so the best advice still to get shots, get your
Yes.
shots, get your vaccines, get your boosters. That's the way that we're
Yes.
going to.
And
we're
right
gonna
now, it's
beat
hard
this.
to act on that advice because we don't have the vaccines available
Right,
yet.
right.
But
you're guessing by the end of September they're
I
going
think,
to be here.
yeah, I've been hearing the middle of September we're supposed to get them. Hopefully that's going to happen, but I would think at least by the end of September we should have them. And I definitely recommend people get them.
So last winter, not only did we have still some lingering cases of COVID, we also had RSV, which was a respiratory condition that a lot of folks were dealing with. And this fall, is there going to be a vaccine coming out for RSV?
I was trying to find out when we would be getting that vaccine this morning, and I don't have an answer yet, but that's also supposed to be available in September sometime. And just to give folks an idea what RSV is, it's another respiratory virus. Classically, it's been associated with really bad viral pneumonias in young children under the age of 1, where they wind up in neonatal intensive care units because it can make them really, really sick. And that's because it really inflames the airways of the lungs, and a small infant less than a year has very small airways to begin with. And if you inflame them, they have a really hard time getting air in and out. But it's also, now we know that RSV also can make elderly patients pretty sick, or people who are, again, immunocompromised. This is a vaccine that's being targeted at both children and adults, and women who are pregnant, by the way, because when women who are pregnant get vaccinated, they pass the antibodies to their infant in the womb, and the infant's protected. So there are 2 vaccines that are going to be available. I'm not sure it's really going to make much difference which one you get. The jury's still out, but from what I've been reading, I don't see where it would make a big difference. They're both about equally effective. They seem to work pretty darn well, which is why I think they're going to release them. And they're probably going to be really effective at preventing hospitalizations in both children and adults. That's what I expect.
Dr. Keith Collins, thank you so much for taking the time to be with us today. We've covered a lot of ground, but a lot of good information.
Thank you very
appreciate it.
much for letting me come on and drone on a bit. I appreciate it.
Happy to.